On this episode of On the Trail with Frontier Nursing University, we visited Frontier community members in Pennsylvania and New York. From the very beginning of CNEP, the community-based nurse midwifery education program, to the Big Apple, Dr. Flinders was amazed by the history, passion, and dedication each individual in clinic demonstrated. Each person is making a profound impact on rural and underserved communities. We first stopped at the original site of the chicken coop in Perkiomenville, Pennsylvania, where CNEP began with Kitty Ernst. Dr. Flinders enjoyed a tour of the farm led by Kitty's daughter, Kate Bauer.
I'm here with Kate Bauer, and this is Kitty Ernst's daughter, and we are so excited to be here in your home and in the chicken coop, which is where CNEP started. So I just wanted to, thank you so much. I just wanted to ask you if you could tell us a little bit about the history of this space and how it came to be.
Sure. So, and just to give people an idea, this is a chicken coop, but it's a very large chicken coop, not one you find in your backyard. And it's been many things over the years. It was the original offices for the beginnings of the American Association of Birth Centers. And when CNEP needed to be rescued from Philadelphia, and Kitty told my dad and my brother to hook up the trailer and go get the student files and everything for the program. She wasn't quite sure what she was going to do, but she knew our offices were here and our staff was here. We were, of course, if you worked for Kitty, then you were always willing to help. And so then she built the offices next door and converted this space into classroom and space for clinicals with exam space.
So how did having that first class and the next few classes in your home, how did that impact your career and your life?
I was really just fresh out of college looking for my first job, and Kitty needed help. And I thought, I can do this for a little bit. 4 decades later, I'm still here. But I think that part of that is that, she just instills the passion and the vision within people. And it's the challenge of trying to mainstream midwifery and birth centers. The work is never done, so there's always work to be done.
We then continued on to Philadelphia, where we held a fun meet and mingle at White Dog Cafe and visited several nurse midwifery graduates at Mainline Healthcare OBGYN.
Hi, I'm here with Dr. Heidi Loomis, one of our clinical faculty members at Frontier Nursing University. And Heidi, thank you so much for being willing to talk to me today to tell me about this particular practice and a little bit about the graduates that have come through here.
Yeah, I'm delighted that several of the midwives here were previously students of mine, and I know learned midwifery really well while they were at Frontier. And it's a proud moment for me to be able to be here and see them working in the clinic and working in the hospital. And I know them as people, and I know that the care that they're providing to this community is going to be of the highest quality and most respectful and compassionate type of care. And it's really a privilege to be able to be here and see them in action working.
Riddle Hospital currently is basically the only hospital in Delaware County that's offering maternity care. With Crozier closing, they had closed other hospitals, part of the Crozier system at that point. So we wound up being really the only hospital that was within a community that really needs care. It's required us to be a lot more flexible, physicians, midwives, nurses, et cetera, to understand the needs of the community and how difficult it can be and how we need to be a little bit more flexible in the care that we give.
So you've mentored so many of our students, and then you continue to mentor the new midwives in your practice. Can you talk about that and about your passion for that and why it matters and what you're proud of?
Precepting the next generation coming in and taking care of women is really important because what we do is really important. And it is ever changing. Like we talked about, depression and anxiety and how that really affects the family and the pregnancy, and then how it really affects the family when, the baby's here, and being able to recognize all of those hot points so that you can step in when you need to step in. It's just ever changing. And I think as a preceptor and a mentor, you have to be there for the next generation to help them grow.
Tell me about the community that you serve here and the difference that you make as a midwifery practice.
We have a big mix of people here coming from different backgrounds, both ages, cultures, economic status. And I think that a lot of our day is spent explaining what a midwife is. I don't think that people are always seeking a midwife when they meet us. But we do find that once they establish care with us, especially in pregnancy, they keep coming back. We get to spend a lot more time with our patients. So we do a lot more education, which I think from being a patient before is important to know why we're making recommendations, and you get more buy-in when you build a relationship, not buy-in, but just more understanding of their own care.
Fantastic. What about, do you have advice for people who might be considering going back to school, or people who are just on the fence or trying to decide whether a Frontier might be the right place for them?
I think Frontier is a wonderful program. I tell people that all the time. I think it's designed for people who are nurses and people who work and have families. I say that, and I mean that a lot. I think if I was going to go back to school, it would be for the mental health program, because there's just not resources for people, right? So a lot of your day is spent, giving clinical care, but a good part of your day is mental health.
We hopped on the Amtrak bound for New York City. Here we held a meet and mingle in Manhattan at Lulu's and visited with DNP graduate Julian Williams, then midwifery graduate Katie Sigler at ULA.
Hi, we're here with Dr. Julian Williams, and we're so excited to get to visit your practice and to get to know you a little bit. Thank you for having us.
Thank you for coming. So excited to have you guys.
What made you choose Frontier?
I chose Frontier because of the model. Frontier has a huge onus and focus on community health and community-based medicine, and that is characteristic to what I provide for my patients in my community now.
And what about your DNP program? What made you go back for your DNP, and how has your DNP degree impacted your practice?
So I wanted to go back for my DNP because, one, is the terminal degree, right? It would provide me the opportunity to affect systems at a greater level. Like, for instance, I'm currently medical director within the DNP program. I learned about quality improvement, okay? In my role here, I am all about quality improvement. There's not a time where I'm not looking at quality metrics and seeing how we are performing, with those quality metrics. It has prepared me how to influence systems, across very clinicians who have different training than I do.
So what about if you had advice for somebody getting ready to enter school, and into a graduate role, or somebody coming out as a new practitioner, what advice would you offer?
My advice would be to trust the process. For anyone who is enrolling into the FNU program, whether it be MSN or DNP, trust the process, right? You're going to get a breadth of knowledge and a great education that is going to prepare you beyond graduation. It is your introduction into learning. And the exciting thing is that even after you graduate, the learning doesn't stop. But what will happen, you will have the tools that will help you impact and continue to grow within your profession. And it's like, once you graduate, you will take off, and you'll be really surprised at how you've grown.
Something else that you mentioned, Julian, that you're passionate about is men's health. Can you talk about that a little bit and how you are able to influence men's health?
Absolutely. I do have a passion for men's health, especially men who may look like me, right? A lot of times we may not access care when we need to, and we may go years without physical, right? And by the time we catch things, I won't say it's too late, but if we had primary intervention, earlier on, a lot of things are treatable.
Hi, I'm here with Katie Sigler with ULA Health. And Katie, thank you so much for having us. We're so excited to see your practice.
Thanks. I'm excited that you're here.
And so at Frontier, as you know, we're really dedicated to building, community-based opportunities and to influencing students so that they can go out and change their community. So that's one piece. And the other piece is really serving both rural and underserved. And so can you tell me how that translates into what you do today?
So when we created ULA, we really wanted to fill a gap in the New York City market. New York City is, there's a lot of midwifery care in New York City, but it really exists mostly at the poles of the socioeconomic continuum. We wanted to take insurance. We wanted to take Medicaid. We wanted to create a spirit of equity among our patient population to really say that this level of care, this, these beautiful spaces that we have created this really high touch, high attention care model. That care model's for all, and that's what we're really proud of.
This leg of the presidential tour was inspiring, seeing the roots of Frontier and how far we've come with graduates in a variety of practice settings and specialties. Frontier graduates are an inspiration to the next generation of nurse midwives and nurse practitioners. Thank you for joining us.